I want to talk about the concerns that seniors have and their rejection, their previous rejection of the government's pharma plan, which is moving from a universal plan where everybody gets the same access, no matter whether you're rich or poor, to one that now will have a line that says above this you pay X, below this you pay less. And as soon as the government gets into these ones that aren't universal, that has a line drawn, then we get into, well, what about the people that have $2 less? They are now paying full freight on this, or above or beyond that line. It just creates huge problems. And yes, pharmaceuticals are not covered under the Canada Health Act. The government is not obliged to pay for them. But we really need to find a better way to pay for pharmaceuticals than charging seniors, basically charging the sick additional money because they need prescriptions. It just doesn't reflect an attitude, a societal attitude that I really want to participate in my province. It's basically saying you're old, you're sick, great, you pay more because you're using more. Again, it's a user pay way of approaching health care. The sicker you are, the more you pay. That I just don't accept. But this government seems to be going in that direction. But I'll put that on the record on behalf of my seniors. And it does disproportionately affect, once again, women, because women tend to be the primary caregivers, both professionally in the healthcare system, but also as volunteer caregivers in the home or in the community. And because women live longer, they are primarily the people that are going to be those elderly, vulnerable, sicker seniors that will be caught in this and be struggling now to find money to pay a premium every month and then to pay a copay or an additional pharmacy fee, or however that's all going to be worked out to get their prescription. So once again, I keep bringing this up and the government goes, oh yeah, right, yeah, and then does nothing about it. But it definitely disproportionately affects women. And that is the best argument for why we should have more women in this House, because we'd have a better understanding of what's going on. Yeah. In the meantime, we don't have more women in this House, and we keep disproportionately affecting women's lives in the way the government decides to do things. So I am really frustrated and angry about this budget. It's not what we were told was coming in either the leadership contest from the Premier nor from the election. And what I get from this government is we're working on it. We're working on Ticketmaster and online scalping. We're working on the environment. We're working on healthcare. We're working on... You know what? I'd like to see the product of your work occasionally, because so far all I hear is that you're working on it and that you're in a committee and that you've got a strategy coming out, which just means you use more trees to publish more papers. But we're not actually seeing the product of that. We can't, your performance measurements, you can't hit your targets. We're not reducing wait times in ERs. We're not managing to give people hip and knee surgeries fast enough. If people are truly in a disaster, heart attack, a stroke, a car accident, and they get through into the ICU, it is amazing. The delivery of the health care is amazing, and everyone talks about how terrific the staff are. But the administration of health care sucks, and it needs to be addressed. And I'm sorry to use such brutal language, but frankly, I can't find anything else that quite sums it up with the same amount of spice. Conviction. Oh, thank you. I'm getting all kinds of help now. Because it does. Your administration of healthcare has failed repeatedly. Now, somehow or another, the frontline staff managed to pull it off for you, but you should be terribly grateful to them for doing that. Thank you very much, Mr. Speaker.